are risk factors. High blood pressure, we talked about that, doctor. High cholesterol, how does that affect?
Well, LDL cholesterol, particularly L, I like to tell my patients for lousy and H for happy, so you want good high cholesterol. Obviously, if your LDL is high, it's a risk factor for cardiovascular disease. But interestingly, in women, LDL is de-emphasized a little bit, and a low good cholesterol, a low HDL, is more of a risk factor for women. And that's a really hard one to change. That's a genetic one. There is no medication for HDL. So cholesterol has a huge role in binding to the walls of the vessels, contributing to plaques, contributing to inflammation, and it's one of the things we really have to target in our practices.
Exactly. Ways of lowering your heart disease, simple things that we can do that could make the difference. And let's show them really quick. Committing to a heart-healthy diet. I mean, I know it sounds like common sense, but it can be done. Exercise daily, at least 30 minutes a day, even if it's a walk, right?
Absolutely.
A walk around the park or a little simple power walk, right?
Exactly.
Watch your weight. Quit smoking. We say it over and over again. How important is that?
Oh, it's equivalent to having coronary disease. I spend a lot of time with patients talking to them, even prescribe medications sometimes, because if you don't stop smoking, you will have some cardiovascular event, whether it be a stroke or heart attack, develop high blood pressure. It's vitally important.
It is. And also know your numbers. What numbers are we talking about here?
We're talking about your blood pressure, we're talking about your fasting glucose, we're talking about your cholesterol numbers, your weight, your BMI, how much room you take up in the world, I like to say, your abdominal obesity numbers, your waist circumference, what I mean. So those are the numbers.
And the BMI, I know most people know what it is, but what is that, doctor?
It's a body mass index. So it's a ratio or a calculation of how tall you are versus how fat you are.
And then manage stress. I mean, I know this is a very stressful world we're living in now more than ever, but it is important to at least attempt.
Sure,
right?
exercise can do that for a lot of patients.